Congratulations, Dr. Pan. One of your articles, which is about bowel preparation, has been published on gastrointestinal endoscopy recently. This is a brief interview, and I will ask you about a few questions. First, could you please introduce yourself and your team?
Okay, hello everyone. My name is Peng Pan from Department of Gastroenterology, Shanghai Hospital of Naval Military Medical University in Shanghai. Our team has over 20 members and is led by Professor Li Zhaosheng and Professor Bai Yu. I'm the first author of the article recently published in GIE entitled Comparison of the Efficacy and Safety of an Oral Sulfate Solution and 3-liter polyethylene glycol on bowel preparation before colonoscopy, a phase 3 multicenter randomized controlled trial. Thanks to GIE for publishing our article. It is my pleasure to introduce our research.
Okay, thank you, Dr. Pan. And what was your motivation and why did you feel a necessity to conduct this study?
Several laxatives for bowel preparation before colonoscopy are available nowadays. PEG is the most widely used for its efficacy and safety, but some people can't accept its taste. An oral sulfate solution, abbreviated to OSS, containing sodium sulfate, magnesium sulfate, and potassium sulfate, has been used as an osmotic laxative for years. Previous studies show that OSS is not inferior to 4-liter PEG or 2-liter PEG plus ascorbic acid in the quality of bowel preparation. However, there was no comparison of OSS to 3-liter PEG, which is recommended by Chinese guidelines and widely used in China. So, we performed the study to comprehensively compare OSS and 3-liter split-dose PEG for bowel preparation in a Chinese adult population.
Okay, thank you. Nice to meet you, Dr. Wang. Could you please tell us about how this randomized controlled trial was carried out?
The randomized non-inferiority phase 3 clinical trial was invited by the National Clinical Research Center for Digestive Disease, Shanghai, and conducted in 10 centers in China. Adult outpatients aged 18 to 75 years who were scheduled for screening, surveillance, and diagnostic colonoscopy were included. Stratified block randomization was performed to keep the OSS group and the PEG group comparable. Subjects in the OSS group were instructed to ingest 480 milliliters diluted OSS, followed by 2 cups of 480 milliliters water the evening before the colonoscopy, and repeated the same preparation 3-4 hours before colonoscopy. Subjects in the PEG group were instructed to ingest 1,000 milliliter PEG the evening before the colonoscopy and 2,000 milliliters PEG 4 to 6 hours before colonoscopy. After ingesting all laxatives, all subjects were instructed to ingest 30 milliliter semicircle. Experienced colonoscopists who were blind to the group of subjects performed colonoscopy in all medical centers. Subjects underwent clinical examination before enrollment and the colonoscopy to assess any abnormal changes.
Nice to meet you, Dr. Zhao.
Hello.
Could you please illustrate the result of the study and talk about the significance of it briefly?
Okay. Well, everyone, my name is Shengbing, the co-first author of the article. A total of 348 eligible subjects were included, and 171 patients in the OSS group and 173 patients in the PEG group were available for the final analysis. Firstly, adequate bowel preparation was observed in both groups, 98% in the OSS group and 97% in the PEG group, which demonstrated that OSS was not inferior to 3 liter PEG in the adequate bowel preparation rate. Secondly, there was no significant differences between the two groups in the acceptability, 94% in the OSS and PEG group. In addition, overall adverse reactions were similar between the two groups, 50% in the OSS group and 44% in the PEG group, which demonstrated the safety of the OSS. In conclusion, our study demonstrated that the speed dose OSS regimen was not inferior to the 3 liter PEG regimen for bowel preparation. The safety and acceptability of the two groups were similar. The speed dose OSS regimen is an additional optional bowel preparation regimen for colonoscopy in Chinese patients.